Hi, I'm Dr. Wendy Goodall McDonald, and I'm here to talk about shaving. Woo, shaving. I remember the first time I shaved, I used a straight razor, like a regular disposable razor. I went to my mama's bathroom, and I actually used my dad's razor that he used on his face on my legs, water only. When I tell you, your girl was on fire, it was out of control. So shortly after that, I was like, well, this ain't gonna work. Let me make sure I do this right. So I found out that there was such a thing as shaving cream, and that made a difference. But later in life, as I started to shave like my bikini area, why, I don't know, I had no reason to do it at the time, but anyway, I started to do it, and I realized, okay, I'm getting ingrown hairs, I'm uncomfortable, and so as an adult, I had pivoted to using an electric razor. Electric razors are my favorite, primarily because they don't shave the hair so low that it will go underneath the skin. That's how ingrown hairs kind of come about. If that hair is beneath the skin, it has to kind of like find its way out of the papilla of the hair follicle. And instead, if you shave it and there's still just a little bit of hair above the skin, you can see that will allow the hair to not get stuck at the skin, which is what ingrown hairs kind of do. So I'm all about the electric razor. Can you do it wet or dry? So there are wet electric razors that are intended to be used in the shower. I do it dry. I don't, necessarily do it in the shower or with any shaving cream. You really don't need to. It does not get the hair, you don't end up baby smooth after, right? It's like a little stubble. I mean, you don't really see much hair. I've definitely shaved and then gone swimming, in a bikini. You don't see it because it's low enough that you don't see the hair. But if you rub your hand across it, you would feel like little hair right above the skin. So if you're trying to get baby smooth, then that's probably not the way for you. You might want to consider waxing or electrolysis or laser. But if you don't care about that, which I don't care about that, and my husband don't care about that, then it's fine to do the electric. Now, how do you do it? So imagine your hair has a direction, right? So most hair is coming out in a direction. If you look up how to shave, how men shave with electric razors, they say shave against the direction of your hair. So you're cutting it, and then that's making it really smooth. That's also kind of allowing it to go really low and close to the skin. Well, better to shave actually in the direction of the hair. So as opposed to shaving against the hair, you shave in the direction of the hair. This has actually been shown to be safer when it comes to even surgical pre-shaving. So first of all, if you're gonna have surgery, don't shave unless your doctor tells you to shave, because a lot of times for C-sections, we'll shave the patient if we need to where the C-section is gonna be. But so don't do this, don't shave before the surgery. But if you needed to shave, or if you've been told to shave before the surgery, they often will say use an electric razor and shave in the direction of the skin, because straight razors cause irritation and can actually increase your risk for infection of the surgical site. And two, you don't want to cause microabrasions if you shave in the wrong direction with an electric razor, which is micro cuts, small cuts in the skin. And so you don't want to do that just in life anyway, right? So it's better to not shave against the skin. It's better to shave in the direction of the skin if you're going to do it. How often? I mean, as often as you need to. The good thing is it's not something where with layla or with wax, you have to wait, right? When you're waxing, you have to wait until the hair grows up enough to be able to grab it. No, you can shave as often as you want with an electric razor. I like a particular brand I'll put in the comments for my shaving of myself. Now, and why? Do we need to shave? Do we need to shave as women or as people with vaginas or vulvas? No, it's up to you if you want to. For me, I do it not just because of the aesthetic, it's not so much that I care what it looks like, but I find that if I have more hair, I may have more smell. There's actually more opportunity when there's more hair there for bacteria to latch onto that surface area. And that even when you shower, when you clean, if you sweat, bacteria like to eat that sweat, and then they want to put off an odor. They want to be funky, okay? And so, I'm running, I'm moving, I'm surgerying and delivering babies and stuff. I don't got time to be stinking. You see what I'm saying? So I definitely will shave just to keep that hair down, to keep the surface area down, for bacteria to try to live there and to have odor. So I keep that down for that reason. And then of course, again, if I'm gonna swim, you're not gonna see me with the bush coming on out my swimsuit. We're just not gonna do that. I'm just not gonna do that. I hope this was insightful. Let me know in the comments if you agree, what you use to remove hair, if you remove hair at all, and what other topics you want me to cover, because hey, we're here to learn. Love y'all. Bye. Bye. Oh, and don't forget to like and subscribe, especially if you want to hear more. Thanks. One more thing. I almost forgot about the chemical depilatories, the chemical meds that are used to remove the hair from the skin. I'm on my lunch break. I don't mind those. You still may have the problem of the hair going back through the skin and getting caught and having ingrown hairs, but you may not. The skin will probably be less irritated, maybe less likely to itch. But some people may have more irritation. Like back in the day when I used that, my skin got irritated. More likely to have allergic reaction with those types of medications. So, food for thought.